Today we'll be talking about an optical instrument called the endoscope. The endoscope consists of an eyepiece, a camera for newer models, openings for other wires and instruments, and two flexible cables containing optic fibers for carrying light both ways. An endoscope is made with optic fibers and is mainly used for medical, industrial, and communication purposes. The property of light which allows an endoscope to work is total internal reflection, when the incident ray is larger than the critical angle. It works when light bounces off of the walls and optic fibers. One of the two or three main endoscope cables, composed of intense optical fibers, carries light from a bright lamp and, in medical purposes, into the human's body. This allows the doctor to see certain parts of the human's body. Light which is reflected off the human body parts bounces off the glass walls of the second cable. The light travels into the doctor's eyes to help them see what is happening in the patient's body. Since the advancement of technology, the cables are inserted into a tiny camera, which is then inserted into the body. This captures images of certain parts of the body and shows the surgeon what to do. It is also used for medical procedures such as arthroscopy. An endoscope is inserted to an incision in the skin near a joint. By looking at the joint, you can see tears in the possible areas for operation. Bronchoscopy. The endoscope is inserted through the bronchial tubes to see any obstructions. Endoscope biopsy. An endoscope is inserted through an incision in the skin, which can help take a sample of the body part for a pathologist to analyze. Gastroscopy. An endoscope is inserted down the throat to look at problems in the esophagus, stomach, and duodenum, such as ulcers or bleeding. The brief history. This instrument was first used during the ancient Greek and Roman periods. In 1805, Philip Bonzini made the first attempt to discover the inside of a human body using a light leader, a light guiding instrument. He first wanted to discover the urinary tract, rectum, and pharynx. Over time, many new inventions were added to the endoscope, such as cameras, cables, and knobs, to make the endoscope we know today.
Problems such as tumors, inflammatory diseases, cysts, adhesions, fibroids, hernias, biopsies, and even exploratory surgery can be found and fixed with a laparoscopy using an endoscope. In this surgery, a thin-lighted laparoscope is inserted into a thin incision on the lower stomach. As mentioned before, endoscopes use total internal reflection. As the laparoscope is inserted in the human's body, it lights up the organs such as the bladder, reproductive organs, stomach, appendix, gallbladder, liver, and pancreas, depending on where it's inserted. The light travels back to the camera where the surgeons act accordingly. Knobs outside of the endoscope control its direction in the body. This is extremely effective. In fact, problems with endoscope procedures are extremely rare, and the only extreme problems can result in bleeding, infections, and organ damage. There are two possible implications with endoscopes, ethical and economical. To begin with, the ethics of endoscope surgery are debatable. Some older doctors did not receive formal endoscope training due to the unpopularity at the time. The question is, are they allowed to do endoscope procedures, or should they go back to receive formal training? Also, many patients object to doing surgery with an endoscope, as they believe it's not as in-depth or done as well as if you open someone fully up. Can doctors do an in-depth surgery against their better judgment, or do they have to take more of a risk? Lastly, there's an increase in endoscope-related infections lately. This is bad for the economy because healthcare fees will increase due to the large amount of post-op checkups and, in worst cases, even more surgeries. In conclusion, endoscopes are very effective tools that use optics to perform minimal surgeries and decrease surgical risk.